It's Debbie Potts, and I am bringing you Dr. Elizabeth Bright back on the podcast to talk about hormone health as we age for men and women. So, what's your motivation, your drive to keep you getting into this thyroid health? Why do you feel it's so important?
Because it rules every function of the body. So actually, the first thing that's formed is after the endoderm and the feet, there's not even fetus yet, is the thyroid. And the thyroid actually grows the rest of the body, causes the development of the tissue. I don't know if you've heard of dermatomes, how dermatomes are the spine, when there's a little tiny fetal spine, all the tissues are connected and then you grow. That's why you can have referred pain in different tissues very far away from the spinal nerve. And it's kind of the same thing with the thyroid. The thyroid regulates every tissue in the body. So if there's an issue, it could be any tissue in the body. Well, iodine is one of them. The iodine insufficient, deficiency in iodine is only getting worse. There's so many substances that I talk about in my last book, Good Fat is Good for Girls, Puberty, and Adolescence, are the many substances that interfere, that prevent the absorption of iodine. And we talk about anti-nutrients all the time as carnivores, they're spinach and that will prevent zinc and iron absorption, but there are so many substances that will actually prevent the absorption of iodine. Added to that, there isn't any iodine anymore because it used to be only goiter belts. 100 years ago, it was goiter belts where actually the soil didn't have enough iodine, so the animals weren't eating it, so we didn't get it. Now it's way beyond that. It's everywhere because of fluoride and PFAs and all of these substances that are inescapable in our environment. So yeah, everybody's iodine deficient. Iodine is important for every cell in the body. It's an antiviral, antifungal, it's an antibacterial, it supports our immune system, and it is a heavy metal chelator. So the 50,000 supplements people are taking, they don't need if they have sufficient iodine. Breast fibroids are caused by iodine deficiency. Cancer is caused by iodine deficiency. Uterine fibroids, it just goes on and on. So Lugol's is what I recommend because it is the easiest to take. Lugol's drops. It has to be what used to be called 15% is the actual Jean Lugol recipe. There's available 2 and 5%. I recommend 5%. You can take 2%. You just have to double the drops. If you are sufficient, 2 to 4 drops should be enough for your daily needs. But the problem is most people are insufficient. So how you figure that out, that's usually I know there are a couple of labs in the US, one lab actually, there's a 24-hour iodine loading test, right? I don't expect anybody to do that. You could do a simple patch test, see how long the iodine lasts on your skin. Practitioners know how to, when I have patients, I give them that information, tell them what to look for. But iodine, the thyroid takes what it needs, then what else is left? The rest of the body takes it. The thyroid needs a minimum of 6 milligrams when you're sufficient. The breast need 5 milligrams when you're sufficient. So we're already miles away from the 150 microgram RDA, which is confusing everybody.